All right, well, welcome and good evening to all of you that have joined us here tonight for the University of Calgary Faculty of Veterinary Medicine's Information Night. Before we get too much farther along in the process, we should first acknowledge the land on which we are presenting from. The University of Calgary, located in the heart of southern Alberta, both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7. Which include the Blackfoot Confederacy, comprised of the Siksika, the Kainai, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Goodstoney First Nations. The City of Calgary is also home to the Métis Nation of Alberta, Districts 5 and 6. So welcome to the Faculty of Veterinary Medicine, and the center of the photograph surrounding all of our animal friends is our Dean, Dr. Weller, the Dean of Faculty of Veterinary Medicine, and on her behalf, I extend you welcome to tonight's proceedings. And I'm understanding that I'm talking to families and young people who are in high school level education mainly, and that's sort of the group that I hope to address this evening. Happy for you to submit questions if you have the chat feature available. We have somebody monitoring that, and they can relay the questions to me. And we'll be happy to go ahead and answer those as we go along. Otherwise, there will be time for questions at the end, and looking forward to engaging with you on those. So the first question I usually ask a group like this is, what do veterinarians do? Many people have, I think, a rather narrow idea of what veterinary medicine is. And so it's always nice when we're in a more interactive audience space to ask what it is you think that veterinarians do and what type of work that they get involved with. I think generally people quickly identify with veterinarians like this young lady leaning over the railing there looking at a sheep. Individual veterinarian working with an individual animal. It could be in this setting on the farm, or it can be in a clinic setting where we see these folks here auscultating the flank on a cow or handling an individual horse. Kind of a theme to all those images. It's one doctor working with his patient. And so that one-on-one relationship, and this is probably one of the most common presentations of a veterinarian that people are aware of. And I think this is often the one that people think of when we ask, what do veterinarians do? They're the doctors for the animals. But there are more things involved with that. Here we see veterinarians out in the field, and they're running their operation out of the back of a truck. So you can see we have adapted equipment so that we can run refrigerators and warm water and all kinds of things when we're in the field. So we're not necessarily in a clinic setting, in a building. We can be out in the fresh air. Sometimes that air is very fresh, but it gets us in around, and we're working in a small business environment. In this case, would be one of the views where you're often you could be the owner of that operation, and you're working for yourself. This is back to the images before, different species we work on, so that we are back in the clinic with cats, and we've got dogs available, again, in this clinic setting. But the species that we're talking about here, those were pretty common, cats and dogs. Everybody's familiar with those, but the species variation today can get quite large. And here we go, looking at a lizard. There are other reptiles that we work with. Snakes, we work with lots of different types of birds as well, and even fish are patients of ours, and they can be individuals. People have sometimes very expensive collections of saltwater fish or other aquarium species, and others have large agricultural operations where we have large numbers of fish under management in an intensive operation. So we get all kinds of different patients, if you will. Another aspect of veterinary medicine is the diagnostics. So we can be working in a lab. We can have veterinarians spend their whole day engaged with microscopes and technology, not really working with animals at all. And in that vein, we have veterinarians involved. This is a picture of a podium event at the World Organization for Animal Health. It's known as the OIE. These are international meetings where nations get together to discuss trade relations and the movement of animals and animal proteins or animal tissues across borders. And so veterinarians are involved in all those international contracts and those negotiations. People don't often think about that aspect. This gets back to public health and how all of us, because we know, and in fact, we had the unfortunate news just the other day of a young person in British Columbia having being exposed to H5N1, the bird flu virus. So these are the kind of things that veterinarians are involved with, concerned about diseases that might either affect us directly or affect our food supply. And so they're involved in the regulatory side, but also in the negotiations and the contracts and trade agreements that are made between nations. Also, you can see these young folks here standing in a pen. This is probably in southern Alberta. As you can see off into the fuzzy distance there are more pens and more pens and more pens. So this is an intensive animal raising environment. This is a feedlot in southern Alberta, and there can be 50 or 100,000 animals on this property. And so veterinarians are also worried about larger than the single individual. They're looking at population medicine and all the animals that live in this space and how that affects them. And this extends to these kind of pictures, which are pretty common in Alberta. We've got some cowboys out working some cattle on the range, and you can see where those animals are located. Very extensive management. There are wide open spaces all around them. They're interacting with their environment. So there's veterinarians that are concerned about those cattle herds and how they interact with the wild species on that property. But there's also veterinarians concerned with the wild species that are existing out there and interacting with our animals and the health and disease that may be exchanged between those populations. And interestingly, we're also worried about the environment, the water sources, what type of contamination issues might be experienced with water. There's veterinarians who find their work in that space as well. So what I'm trying to do is just widen the scope of what you think a veterinarian might be as we start our exploration. And one of the other areas that's very important is in the areas of research. And here we can see this horse being rigged up with a mask that's reminiscent of some type of World War II gas mask, big basket over their nose. But what we have here on the right of the screen is Dr. Renaud Legulet. He's one of our instructors here at the Faculty of Veterinary Medicine. He's an equine sports medicine specialist. This horse is a sports athlete. It's a racing horse. And what we're looking at now is being able to do research. And there can be various levels of research that we look at. We could be examining how do we help this horse in its training so that it's a better athlete and be faster on the track. We can also be looking at very basic questions. How do horses manage to convert that energy in their body when they're moving all that mass so quickly? So we're looking at the rate of the consumption of oxygen and that type of thing. And so that's what this device is that's being placed on this animal's nose. And in the 21st century now, we have technology that allows us. Before, we used to have put this horse on a treadmill and we could stand beside him and have all our equipment in stationary. But now we have technology like Bluetooth and others that allow us to put the instruments on the animal. They're miniaturized, they're pretty light. And you can see the gentleman in the background wearing the yellow helmet, that's the jockey. They're gonna mount that horse and take that horse out onto the track and collect data on the horse as he's exercising around the track at full speed. So these are the kind of things that also veterinarians get up to, looking to increase our basic knowledge about animals or to help us refine our knowledge about a niche area like equine sports athlete. And this area is growing rapidly. I've got a couple of images here to show you the things that we're getting involved with. The dog on the left there with the collar. I'm sure many of you out there have a Fitbit or a smartwatch or something on your person that's busily keeping track of you right now. If you look at it, it'll tell you your heart rate. It give you an idea how many steps you took today. Well, these devices now are being adapted to be used on our pets. And so that's what that beagle is wearing, a device that's gathering information. And that information is going to be, could be sent directly to his veterinarian at the clinic that they go to. And who knows how many times a day that thing might send information. So now you have the situation where we have a lot of data coming in. And so in veterinary medicine, there's a growing need for people to understand how to manage all that data. How do we know the signal from the noise, is what they say. We've never really listened to a dog's heart 24 hours, 7 days a week. So is that arrhythmia, or is that just a normal variation as the dog is living its life? And those are the kind of things that we need to sort out now. And do we need to know? Maybe we should contact the dog's owner and say that we're getting some information in that suggests that we should have a look at your animal. Those are the areas that we're moving into in veterinary medicine on the companion animal side. On the other side of the screen, you see that large cylindrical black object. This is a device that we give to cattle. It's called a bolus. It's a really large pill, if you will. It's quite large in diameter, something along that line, and about this long. The cows can quite easily swallow something like that. It will reside into the rumen, or actually the reticulum of the cow's stomach, which is the second chamber. And this device has a battery that lasts for 6 years and has a broadcast range of over 800 meters. And it does the same thing as that device that you saw on the dog. And it's giving off information. So you can have a dairy herd, and all your dairy cows have these devices in there giving off information. Again, we need to sort out what's important and what isn't important. That's part of what we're doing right now. As I speak, people are looking into that. But we'll get a notice then if some animal is having a problem. Maybe she's calving, maybe she has milk fever, some type of issue has popped up, and then an alarm would be raised, and the producer would go check the animal, and then if they need be, they would call a veterinarian. So these are the things of the future. And in the center there, with looking very ominous with its camera pointed directly at us, is a drone. And these are being used quite often now in veterinary medicine. Remember that picture earlier I showed you of the feedlot? We used to have to get on horseback and ride the pens to see if we could find sick cattle. Cattle don't become alarmed if people are walking around on foot amongst them, but they seem to tolerate horses quite well. So you could get on a horse and you could stroll through the pens, and you could see if an animal wasn't well, if it was hanging back or displaying unusual behaviors, and then we would go and get that animal out and have a look at it. So in addition to having these boluses, you could also just fly a drone over top of that. You don't have to get out there and saddle your horse. You can get out there and fly a drone over top of those pens and pick out individuals that are looking like they're holding back or in need of care, and then and get them pulled from those pens so you can have a look at them. And these drones are also, the cameras on these things are amazing. You can read the ear tag of a cow from quite a long distance away. So that means when those pictures earlier of extensively raised cattle, drones can be used to monitor them, to go find them if they haven't shown up in a while, to make decisions of whether or not they need help. And so these areas are being developed right now in veterinary medicine. So it's a very exciting time as we move forward. So that was just sort of my introduction to veterinary medicine, to indicate to you the breadth of the opportunity that's available in veterinary medicine and the different pathways to go. I like to say that there's a path for everybody in veterinary medicine, whether you be somebody who's really into spreadsheets, or if you're really into taking care of individual animals. We have pathways in veterinary medicine that are important, that need people, and allow you to interact with our animals and our environment and make a difference. So now to bring us back to back to home here, I'll just give you a quick kind of virtual tour of what we have at the Faculty of Veterinary Medicine at the University of Calgary. First of all, we reside on multiple campuses. So the University of Calgary has several campuses, and we are on 3 of them. Here is a picture of 2 of them. At the top of that is a picture of where I'm speaking to you from right now. I'm at the Clinical Skills Building on the Spy Hill campus, which is in the northwest corner of Calgary. The picture below is the picture of the Foothills campus. You can see the Foothills Hospital complex just on the right-hand side of that picture. And that we have a presence in that location as well. Many of our research faculty are located down at the Foothills campus, and that's where we have some of our lab space that we share with the Faculty of Medicine. At the Spy Hill campus above, also have many of our faculty out here, and this is where we do much of the instruction for students in the DVM program. And at the Spy Hill campus, we recently underwent a bit of an expansion when our class size grew from 30 to 50 a few years ago. And so I'll just show you some of the newer facilities we have in here. So this is our small animal operating room, training area. And you can see it's quite large, and it's beautiful and bright. And so in here we can, where students train to operate in a sterile environment and do surgical procedures on small animals. So this is a place where they'll spend a lot of time, especially in the third year of their program. In addition to facilities like that, we have several wards. You can see the signs going down: large animal handling, bovine. In the distance, that one reads equine. And at the very end is small animal, where that last picture was from. But we have this large open space at the back of the building where we have facilities to work with horses and cattle and other large ruminants or smaller ruminants like sheep, and can easily be accommodated in our space at the back, llamas and alpacas. So this is part of our teaching family. We have a teaching herd of about 40 horses and about 40 cattle that we use for the students for instructional purposes. Our small animals, we rely heavily on a program called Pet Professors, in which case animals, dogs and cats that are owned by either faculty or students or staff come in, and they become the surrogate patient for training our veterinary students on. They don't undergo any invasive procedures. They're there so students can learn how to do physical exams and how to hold and examine animals. And so that's how we get our experience with the small animals while they're on these locations. The fourth year, so the first 3 years of our program, the DVM program, are held here on campus. The fourth year of our program takes place in what we call the distributed veterinary learning community, which are cooperating practices all around the province of Alberta. So in fourth year, our students are out in active veterinary practices getting their clinical experience. And in addition to the 2 campuses I've just mentioned, we have a brand new campus that's been provided for us through a very generous gift. This is WA Ranches. This is located about another 25 minutes northwest of the Spy Hill campus, kind of straight west of Airdrie and north of Cochrane in that countryside there. You can see it's a very large gift. It's 19,000 acres. It has a resident herd of 1,000 mother cows and 65 bulls, so it's being run as a running ranch. And we have this cropland of 2,000 acres. So it's a very big operation. And we've just recently acquired that, as it's there in 2018. You can see a couple of pictures here. The top picture is what they call the home place. You can see the one house in the top left-hand corner. This was some of our limitations initially because there was only one bathroom, so it was difficult to take our students out there. You can see in the lower picture, the cowboys are bringing the cattle in the spring. Lovely spring picture, and the calves are probably being sorted and tagged at this point in the spring. But we've made some renovations out there just recently this year. We have gone ahead and got some classrooms on that site. So you can see there's a group of our students gathered in front of their new classroom, and you can see another picture with them inside the classroom that's out there at WA. And we have a couple of those on site. So now we can take students out there in the early years of the program, first, second, and third year. They can be out on a working ranch. We have classrooms so we can teach them in, and then they can get out of the classroom and go experience things. We've recently closed in this building to make it a proper barn with a water station on the side so that we can, again, accommodate having a full class of students out there. And then on the inside of that, you can see we have these handling facilities, chutes and chute systems so that students can work with the animals. First of all, they have to learn how to work safely, in those spaces. And so the animals are also safe and confident when they're being handled. And then they can learn some of the basic procedures of working with ranch cattle. Now, I remember we mentioned we already had 40 head of cattle here at Spy Hill, but the cows that live at Spy Hill are really quiet, very well-settled animals, very used to human contact. The cows that live out at WA ranches they make their living the old-fashioned way, out on the wide open spaces. Remember, there's 19,000 acres. Some of that is the Eastern Slopes lease land. We have all kinds of wildlife that share those pastures, including grizzly bear and cougar, wolves, coyotes. So those mother cows out there are proper mothers. They behave a little bit more differently than our quiet cows who are used to being close to the city. And so you have to learn how to be safe and how to manage those animals and how you can get them in so you can comfortably look at them and examine them. So that's the present facilities we have right now. And the exciting news that I want to share with you tonight as well is that we are expanding again. So in the fall of 2025, we're going to be going to 100 students. Currently, we admitted 55 this September. Next year in September, we're going to admit 100 students. So this picture is a more recent photograph of the Spy Hill campus. And you can see that concrete structure hiding behind there. That's a 3-story building that's going up. That's going to provide us with some more space, because we don't have a classroom that'll hold 100 students as I speak to you today. But I am told confidently by our construction folks that by the summer of 2025, we will be able to be inside that building, and we'll have available to us 3 classrooms that can hold large classes like that. So this is a pretty incredible thing. I have to just pause for a minute here. My career has been quite long in veterinary medicine, and I find this to be very encouraging and exciting, and I'd like everybody to share my excitement with that. In 1969, the Western College of Veterinary Medicine opened in Saskatoon, and that college was supported by the 4 Western provinces. Alberta provided about 20 seats for Alberta residents in 1969. It was a little less than that initially, but it grew to about 20 seats. So that allowed 20 Alberta residents to find their way to veterinary medicine every year. And it was that way until our faculty opened here in Calgary in 2008. And we added 30 seats to that total for Alberta residents. So that's a long stretch. That's nearly 40 years that there was no change in the opportunity for veterinary medicine for Alberta residents. The population of Alberta in that time span grew from something around 2 million to something over 4 million people. And the opportunities hadn't changed. So that was a very big deal in 2008. So suddenly now there were 50 seats available for Alberta residents. So that was a big deal, a big moment. And as I say, for me, this is like a generational change. It takes time for these to happen. And that took an especially long time. In 2020, we repatriated those 20 seats that were in Saskatchewan to Alberta. So now that all of those 50 seats were being offered here at the University of Calgary, and the University of Alberta no longer sends students to Saskatoon for training. They all come here. But that didn't change the opportunities for Alberta residents. It was 50 seats before that. It's still 50 seats after that. So you can see it's not until 2025, again, almost another 20 years since our first opening, that there's another very large enhancement to the opportunities for Alberta residents. And now we're going to 100. So to me, it's important to understand the generational nature of this and the magnitude of this growth. It's a very big deal. It's a very big deal for the profession, and it's a really big deal for young people who think they'd like to take on the challenge of becoming a veterinarian. So this is the Spy Hill campus. The building I'm speaking to you from is labeled there in the light yellow, the clinical skills building. And you can see the orange building is that new one. That's the Veterinary Learning Commons that were under construction. These are some renderings. I showed you the picture before. That was a few weeks ago when it was all in concrete. Now they have it covered in waterproofing, and they're laying in the windows. So it looks a little different, but when it's done, it's supposed to look something like that. So that looks pretty impressive. we're really looking forward to what that's going to be like. And then this gives you some of the lay of the land inside. You can see again some photographs that suggest what those rooms will be like. So we're really looking forward to it. It's going to be a very exciting addition to our campus and for students that come to join us in the program. Again, this is what they imagine a classroom will look like in that space. So it's going to be pretty exciting for us. And to go along with that, we are having to address our curriculum. Clearly, going from 50 to 100 students means that some things will have to change in what we've done in the past, especially when we started with 30 students per year. We've had to adjust to the larger number of students and change some of the things we're doing as we accommodate these larger class sizes. And so that's happening right now. We're busy in the process of examining our curriculum and determining how we're going to manage that larger class. And so the people I'm speaking to today, I imagine it'll be several years yet before you can reach the time in your life when you can apply. But we're going to have a brand new curriculum for you when you arrive, one that will have integrated courses. And by that, we mean that you'll be taking subject matter that relates to other parts of the other subjects at the same time, so you can connect those dots right while you're taking the courses. It'll offer independent study time, because by the time you get into the program, you're a mature student. You should be well experienced, so we're going to let you take care and manage your own time as you explore the career options and opportunities that are available in veterinary medicine. So you can see the general themes in year one. As you come into the program, we start with healthy animals. We figure out our normals. Then in year two, we start to explore what happens when disease strikes, various types of disease. It could be injury, it could be infection. And then year three, we now have to figure out how do we diagnose those ailments, and then what treatments can we offer as we put together our third year. And then, as I mentioned, in fourth year, off into a clinical training and with our partner clinics in and around Alberta. So that's just a quick view of the curriculum. I'll give you also a quick view of the process to gain admissions to the program. I recognize that will be some time before most of you will be applying, so you have to bear witness that some things change over time. This is what we do right now. I am hopeful that it will be something similar to this at the time that you're considering it. But as I noted, you must be an Alberta resident. I don't see that changing in the next little while. So what's an Alberta resident? Basically, if you were born in Alberta, you don't have to worry about it. You'll be an Alberta resident. This can sometimes be a challenge to sort out. Our office can easily help with that definition. A quick measure of whether you're an Alberta resident or not is if the Alberta government will give you a student loan, you're an Alberta resident. So there are other tests that we have to apply, but that's the simplest one. And as I said, you have to be at university. You have to have completed 2 years of university by the time you're admitted to the program. So if you're in high school right now, what your job ahead of you is to make sure that you maintain all your options so that you can get into university, especially into a science-based university program. And then you have to go ahead and take some courses at university. You can apply while you're completing your second year of your university studies so that you can be admitted at the end of that second year and start the DVM program. But you can also complete a degree and then apply. You just can't apply right out of high school. You need to go to university first. And part of the reason why we have that is we have some required university level courses that you must take as part of the prerequisites for the DVM program. These are not different from many of the other health sciences programs. So you'll find similar requirements for medicine and dentistry and other health sciences based programs. So not surprisingly, there's the biology courses, chemistry, organic chemistry, biochemistry. These are the kind of basic science courses that you need to have, and these need to be university level courses. So that's why we need that 2 years of study. These courses need to be done before you can get into the program. So what are we looking at? Currently, we have changed our process a few years back. We used to have entrance that was competitive based on your grade point average, GPA. And the GPA system that we use is a 4-point system. And when we were looking at GPA and then trying to identify applicants based on that, we quickly got to this point where we couldn't interview everybody who applied. So we had to just rank everybody by their GPA and then interview the top about 130 that we could interview. The consequence of that is that the GPAs just to get an interview got very, very high, higher than 3.7 out of 4. So we readdressed that problem and decided that we have always said that a GPA of 3.0, which is a B or a slightly higher B average, is adequate to be able to manage the academic requirements of the veterinary medical program. So we decided to make that a threshold. So you need to have a minimum GPA of 3.0 in your most recent 4 undergraduate semesters or terms. And so that would be like your first 2 years. That's the target. You have to have a passing grade in those 10 required courses. Now, GPA has a fair amount of variability, especially it can be variable within institutions. So between different faculties on the same campus, it can vary between institutions, between different universities and colleges. So we needed a second measurement to provide us confidence on the academic ability of the applicants, something like a standardized test. So we've adopted the MCAT, the Medical College Admissions Test. Now, people get excited about that because they've heard all kinds of terrible stories about it. In fact, it examines exactly the same material that we're interested in for veterinary medicine. So it's the appropriate test. We've done the same thing. We've looked at this test and found out, how do we make this a threshold? We don't want to compete on the MCAT score, which is what a lot of medical colleges do. And when you compete on your MCAT score, then to get into medicine, you need a very high score. So 495 doesn't mean anything to you at this point, but I can tell you the way that exam is put together, the average score of everybody who writes that exam is 500. The top score you can get is 528, and the low score you can get is 472. So you have that range. And we've looked at it, literally hundreds of thousands of people write this year, something like 250,000 people write this exam every year. So there's a lot of data out there. And it shows us that students who get 495 or greater on their MCAT exam finish their health sciences program 90% of the time on time. And that's what we're looking for. So that's why we selected that number. So those are the two main things for admissions to the veterinary program: a GPA of 3.0 and an MCAT score of greater than or equal to 495. If you have scores above that, well done. But it doesn't enhance your opportunity, but it does make you comfortably within the window. Once people are in our academically qualified pool, we look at each applicant's file. We gather all kinds of information at the time of application by applicants. They provide us information on their hobbies, their work experience, their volunteerism. Clearly, we have the information on their education. We have information on the jobs that they've held, all of that. So it paints a pretty good picture of the applicant. And our file reviewers are having a look for applicants that fit into the program we have for veterinary medicine here at UCVM. And remember, all of those different career paths I talked about at the beginning, that's what we're looking for. We're looking for people who line up on those career paths. And so applicants often ask, well, does that mean I have to volunteer in a small animal clinic, cleaning cages for weeks and months at a time? No, that is a viable opportunity. That means you're being exposed to small animal practice and you're getting to understand the profession. It's probably a very good thing to do to enhance your application. But you could be doing other things. You could be doing research. You could be working with cattle. You could be working with horses. You could be working with race horses. You could be working with the environment and wildlife. There are other avenues that are important to veterinary medicine that will show up on your application file that will obviously indicate that a DVM is an appropriate degree for you. So that's the kind of thing to think about when you're looking at filling out your application and what type of experience you might need. once we use that file review process to rank our applicants for interview. Again, we can't interview everybody. We get a lot of applications. So those applicants that line up really well on our DVM program, those are the ones we want to talk to. And that's how we decide who we're going to interview. And the interview, as you can see here, is a multiple step process. We have a multi-mini interview format. This is basically mini interviews. They're about 10 minutes apiece. Each one is based around a scenario. And the way it works is the applicant will read the scenario, have a few minutes to formulate their response to that scenario. Then they'll enter a room. There'll be two raters in that room. They will deliver their response to that scenario to those two people. And that whole thing takes 10 minutes. And then they move to the next station. We do that 7 times. And so we get multiple people. If you have 2 raters in each room, 7 rooms, it's 14 different people view the applicant, along with the 3 faculty members who reviewed the file. So we've got 17 different people at this point who have formulated an opinion about that applicant. And that's the interview process. In addition to the interview, we have what's noted on the slide here as an on-site essay. It's really a supervised essay. We have set up an exam station on the University of Calgary campus, but we'll set up exam stations in Edmonton. We'll have them in other parts of Alberta. We'll have them in other parts of the world, because Alberta residents go to take their university all over the world. So we make arrangements for people can write a supervised essay. It's a similar idea. They get a scenario. They get 750 words and 1 hour. You get to respond to that scenario with a written essay. And that essay is then graded by 3 other raters. So now we're up to 20 different people who have made an opinion about the applicants. And we still use Casper, which is an online situational judgment test. It's similar to the multi-mini interview, but it's basically one station. It's a scenario that you respond to online in text and video format. And so it's just, we had to use that very extensively during COVID when we couldn't actually hold interviews. And so we still have that part of our process. We're evaluating it at this point, and that may be something that changes by the time you might apply. The multi-mini interviews right now, after COVID, we're holding those in a virtual environment. So we used to have to get everybody to come to Calgary. So if you were taking your university education, say at Queen's University in Ontario, you'd have to get back to Calgary for this interview. That's expensive. Traveling out of the roads in Alberta in March when we hold our interviews can be downright dangerous. So we're in the virtual world. We have a system that works, and that's probably will be still the way we're doing things in the future. And so that generates our scores. Those 3 things. The multi-mini interview is worth more than half of the final score. The essay is about 1/3, and the Casper is a small percentage. We add those all together, and that's the way we rank our applicants for admission. And then we just take that rank list and invite, and now in the case, we'll invite the first 100 to join the class. So that's the process for veterinary medicine as a Doctor of Veterinary Medicine degree. But I want to also draw to your attention at this stage that there are other aspects of education at the University of the Faculty of Veterinary Medicine that you should be aware of. And I call these sort of veterinary adjacent. We have research faculty. Those research faculty will be supervising students who are doing what are called master's degrees or PhDs, professors, philosophy degrees. That Doctor of Philosophy degrees is what a PhD is called. And these are advanced training. You're working very closely with one of our faculty members as your mentor and involved heavily in research. And here are some pictures of some of our graduate students right now who are working on different projects. Those projects can be, as you can see, in a lab where you're wearing a lab coat and doing that type of work, or you can see, as the young lady just opposite that one, out in the country. She's working on a project that involves controlling flies with cattle. The picture just above, the gentleman in the wine bunny hug, as we call them in Saskatchewan, is actually doing international work. His work is in Asia, but his graduate studies are here with our one of our professors. And you can see the same on the image on the upper right. We have veterinary students, or not veterinary students, but veterinary graduate students working on projects in other countries. So there's lots of different avenues you can go, not only the wide definition of what a veterinarian is, but other educational opportunities that the faculty offers if you don't select to become a veterinarian. And here's a little more of a details on what those programs are like. Masters are a shorter time in the program, usually completed in 2 years, often take a little more than 2 to 3 years. PhD, you focus at 4 years, but they can take a little longer as well. And you can see the details of those programs with thesis, and sometimes there's course-based degrees, but these are very bespoke. These are custom for each individual graduate student. They're working on a project with a supervisor and become experts in a certain area and when they graduate. And that's to support research. So the graduate students are working on research projects with our faculty. Our faculty have many wide and diverse research interests. And you can see that they range from things that are probably pretty natural to think about in veterinary medicine, like cattle health and infectious disease. But we have other areas of detailed research, pain and animal welfare, equine health, we have wildlife health, reproduction in general, and specifically looking at in individual species, especially those involved in production agriculture. And regenerative medicine is also an area where we're looking at, this is where you're looking at molecular and genetic involvement and research in that space as we develop new ways of understanding and new therapies that will help us in the future. And so that brings me to the end of my formal presentation, and I'm happy now to field some questions if there are any, and I reach over to my colleagues who are watching the chat to see if there's anything there that I should be responding to.
Dr. McCorkle, are you able to speak to, with the expansion, approximately how many students we may consider for interviews? I know this is a bit of a number and concept right now.
Yeah, this is a dynamic question we are dealing with right now. As we're awaiting the number to see how many applicants we have to process this year, we would like to give as many people the opportunity as we can.
Oh, God.
But we have some challenges with as I mentioned, all of the people that are involved in our application process. So we have to make sure we get all of the volunteers that we need necessary in place so we can hold all these interviews. I'm expecting, I mean, I'm optimistically hoping that we can interview something more than 160 people this year for those 100 seats. I expect we'll have more than 200 applicants to deal with. So we'll have to make some selections before, based on the file review, before we actually do invite for interview. But as you say, we need, our program needs a lot of helpers, and we have to line that up. And that's what we're in the process right now of gearing up. It'll be more people than we have ever interviewed before. And so that's a challenge for us.
I have a couple questions, Rob, that I'll read out to you.
Okay.
The first one is, what is the average acceptance rate of applying students?
So averages are interesting things. I can tell you that the applicant pool is still skewed to the right, as they say. It still has an average GPA of about 3.6, 3.65, somewhere in that range is the average GPA of our applicant, or has been in the past. I don't know this year's because we haven't got the data yet. But that ranges from 3.05 right up to 4.0. We tend to get a lot of applicants in the high end of that range. And so that's why that number is higher than, say, 3.5. And that just reflects the numbers of people who apply. But we look at all of them. We have interviewed people who are just 3.05 or 3.2, in the past, and we will again this year, I anticipate, so that it's not part of the selection process for interview. When those files go out for review to our file reviewers, we take the liberty of removing some information, so they don't get to see all of it. They don't get to see the GPA or the MCAT score. They don't get to see the name. They don't get to know the gender of the applicant. And that is to keep it fair. What they're going to know is there's a person with these experiences and this history and this interest, and that's what they're going to base it on. We've already done the academic selection, so by the time we send it out for file review, we've already declared that this applicant has the tools necessary to be successful. Now we want to find out how well do they line up for a DVM. And so, yes, it's interesting to look at those averages, but that's not something that you necessarily need to focus on as an applicant. You need to make sure you're better than those thresholds, 3.0 and 495. Once you're above that, you're in the pool.
Okay, second question. Do the 3 references have a role in section?
Yes, the referees are part of the file review process. So you will nominate as an applicant 3 references, and we will send them a questionnaire. That questionnaire will come back to us and will be included in the file, and that'll be part of what's assessed by the people doing the file review. So that's where the referees come from. And that's again generating this general overall holistic picture of who that applicant is. We have opinions. We prescribe who those referees should be. We ask that they be somebody that's been your employer, an instructor, and a close. You can have a close personal friend or acquaintance, but other than your family members, right? And we would expect your family members to give you a glowing response to all questions, but we're looking to get a wider picture from 3 people who we can put some weight on their opinions. And so that goes in with all the other information to help us get this picture of who that applicant is and how well they line up for the program.
Great. Next question. Are there universities that you suggest taking our undergraduate school at?
No, I don't. We have lots of good quality universities and colleges, or polytechniques, as many of them are now being known in Alberta. They're all satisfactory and provide the adequate courses, especially in Alberta. It's easy for us. There's a program called Transfer Alberta, so it's easy for us to make sure that the courses you take line up on the prerequisites we need. If you take your education out of province or out of country, then there's a certain alignment. We have to make sure that those 10 required courses that we have are covered. And wherever you go, you'll find that curricula are a little different, things change. So there's a little step in there where we have to make sure that whatever courses you have taken actually satisfy our requirements outside of the province. That's much easier for us to do it within the province because of that Transfer Alberta tool. But any recognized university is going to be adequate. It has to be a university or a college that offers university level courses. There are other training institutions out there that provide courses that sound the same, but if they don't have, if they're not accredited at a university level, those courses will not be accepted. So that's something you have to look at when you're leaving high school and going into post-secondary education. You need to be at a university level training when you're to fill out your requirements for our program. But we play no favorites. We have students from everywhere, from all the colleges in Alberta. Actually, right now, and then for the last several months, we've been visiting the colleges in Alberta to also share the same information. And we usually bring a student or 2 with us who's an alumnus from their college. So just to bring home the point that, yes, people from Medicine Hat can go to the Medicine Hat College, the Lethbridge Polytechnique, Grand Prairie Polytechnique, all this, because Northwest Polytechnique, they call it now. Any of those, we have students in our program that come from those institutions, as well as University of Alberta, University of Lethbridge. Those are all perfectly fine. And then University of Saskatchewan, and the list goes on, University of British Columbia, on and on and on. So, yeah.
Would just add one point, Dr. McCorkle, that just keeping it simple, that we just take courses from degree granting institutions. So unfortunately, Olds College, NATE, or SATE, or any of those types of college or programs, we don't unfortunately take coursework from. So as long as
Yeah.
it's degree granting institution. Yeah.
Yeah, they're just at a slightly different level. So
Yeah.
the courses don't line up with Transfer Alberta. So it doesn't work.
Yeah, which leads into our next question. Do we have a preference between someone who's taken pre-vet or biological science degree program?
No, not just on those two parameters. I mean, I would imagine the applicant who's in a pre-vet program probably has a healthy resume of veterinary experience. Often, I'm just going on my stereotypical view of a pre-vet student. They tend to be very focused, and they will have had summer jobs in veterinary clinics. They would have been shadowing veterinarians. That's not an uncommon background to see with a pre-vet student. If you come through biological sciences or something, you may have taken a bit of a path before you identified veterinary medicine as where you want to be, but you may be involved in research, for example, and that's a perfectly acceptable background to have coming into the program. And if you want to enhance your knowledge of the veterinary profession, it's easy enough to go and get some limited experience or with clinical veterinarians, but not necessary. The research alone, especially if it applies to animals and those type of things, or questions involving animals, will be adequate to make a good argument that a veterinary degree makes sense for you.
Next question, is experience in the veterinary field required and or preferred before applying?
Yeah, it's not required. Obviously, it's considered an asset. It's a big step, right? You're going to be committing at least 4 years of your life to an educational program. There's it's financial and also time and challenge on your part, a lot of studying. So it makes sense that you have some idea of what you're getting into. And people, resumes that show that provide a little more confidence to the applicant, or to the reviewers, that this applicant has done some looking around and is aware of what they're getting into, and this makes sense for them. So that's why it's an asset. It's not required. As I said, you could be very focused on environmental issues, for example, and be concerned about diseases that affect wild animals, or maybe wild animal and domestic animal interfaces, those kind of questions. And that's a very good background. You don't have to have spent a minute in a veterinary clinic, but that makes sense. That's the epidemiology side of our profession. That's international. Remember, I was talking about and movement and trade in animals. We need to know what's going on in our wild populations. So, yeah, I think the way to look at it is to see how well, if you looked at it objectively, does that resume, does it line up? Does it speak to you that this person would be, that veterinary medicine makes sense? That's really what we're looking for. Clearly, there are really obvious pathways, but there are other ones that's what I was trying to do at the beginning, to expand your minds as to what it is to be a veterinarian. Biotechnology is a huge thing. It's growing. We're having all these devices that are now becoming available for our animals. Maybe that's something that is what really excites and interests you. That makes sense to me. We could use some of these tools. So if that's where you've spent your time as an engineer, biomedical engineer, and now you want to be a veterinarian, perfectly makes sense. There's lots of opportunity for you.
This next question is a little specific. So this particular person is looking into an undergrad program that has all the required courses listed from our website, except for one. How would we recommend them getting this one course?
So there are multiple ways to get a single course. What we'll be looking at, so in applications like that, we would have, we first need to satisfy the 4 most recent semesters or terms. So we can look at those. And even though in those terms, maybe you don't have all 10 of our required courses, you could take the missing course outside of those terms. So there's University of Athabasca, you can do online programming, you can take them at summer school. We do need to see, as we review your transcript, all 10 of those courses, and there has to be a passing grade for them. So we can still find 4 semesters that meet that requirement for the GPA, and then find the 10 courses. Now, if you've been at university for a while, you might have the required courses back a little ways in your transcript. That's fine as well. As long as they're in there, we'll find them, and that they have passing grades. So that's what we're looking for. And so if you're missing one that's often comes up that we're familiar with, and it's part of our uniqueness here at the UCVM, is we require an ecology course, and many other health sciences programs do not. And so if you've been lining up on them and you don't have the ecology course, there are ways to take that on its own, just to make sure it shows up on a transcript for us at the time of application.
Moving on, how many people do we have apply per year normally?
So there's nothing normal just yet. As I mentioned, and I'm sure all of you have recent memories of COVID, everything changed, though those required very rapid adaptation to new techniques for our interview process, because we did everything in person right up until that year. In fact, we were simply 5 days away from doing our in-person interviews in 2020 when the whole thing got shut down. And so, yes, there's been a big change in how we do things. I told you we changed the requirements. And in that process, people have had to adapt and adjust to those new requirements and the new process. So the applications, this reminds me right back at the beginning when we first had our first class back in 2008. The faculty had never existed before. We suddenly were there, and we made the option to apply to University of Calgary. It was a small applicant pool that year. And then it slowly grew year after year until finally we couldn't interview everybody who applied. And finally, we had no way in hope in interviewing everybody who applied. We had large numbers. And that's exactly what we've done. We've had a reset. And every year since COVID, the numbers have been growing. We don't know what we're going to end up with this year, but I'm fairly confident saying that I expect there'll be more than 200 applicants, qualified applicants who will be going forward to file review. It's also important to recognize that because we have the threshold system, people can see if they qualified before they submit their application. So many people who might have submitted in the past don't bother because they recognize they haven't met that threshold. So that messes with the numbers a little bit, but we have a solid applicant pool. We have lots of competition. Every year that I have been involved with this, and that's just about all of them, we have said no to more people than we have said yes to. That's the sad part of this whole process. And I expect that won't change this year, which is a bit disheartening because I would like to welcome as many as possible. All who have interest and ability, I'd be happy to get you the education, but that's unfortunately, there are certain realities in the world we have to deal with, and we only have the ability to take in 100. So there will be plenty of applicants in the pool, and the competition will be real.
This next question is a good one. How does UCVM ensure graduated students transition smoothly to the workforce? I've heard many DVMs from various schools say the jump from school to workforce was very hard on them.
Yeah, that's an interesting observation. I won't deny that. I mean, I think that's ever been the case. Going to school is a lot different than working. There's no doubt about it. And especially in veterinary medicine, you are one of a class. You get a little bit of exposure to being in clinics. You get some of the reality, but once you're out there actually working, you're the doctor in the room. And I remember the first time I was called that after graduating. It was, you took a little minute to settle that in and realize that, okay, I have to come and adapt to this space environment. So yeah, that's normal that there's that transition phase from being the student to being the doctor. We have an extensive program here in our curriculum that deals with that. It used to be known, it's currently known as the professional skills program. It may inherit a new title in our new curriculum, but it will still have the same content will still be in the program. And in there, we work on those skills about how to deal with the pressures of day-to-day business of dealing. I used to say you have, 15 or 16 different bosses every day. Every animal, every case you see comes with a new owner. That owner is essentially your boss, and you're going to be listening to them, and you're trying to figure out how we can help them and their animal in a moment of need. And it changes. You get done with that case, there's another one, and there's another one, and there's another one. So we have a professional skills program that helps you learn how to reset, because some cases can be great, successful, and everybody's happy and wonderful, and other cases can be tragic. And so you have to be able to get those tools. We help you develop those while you're in the program. We give you those skill sets so that when you get into practice, you have something to fall back on and use when you get into those situations. When you recognize you are the doctor in the room, it's you, the owner, and the patient, and you got together, you're going to figure out how to resolve this problem. We take an active role. And in fact, that was one of the things that I found unique when I came to join the faculty. I got here before the first students got here, but that was a focus. That was never a focus in most veterinary programs before that. It is much more common now, but to recognize that that was important, that we gave time to our curriculum to support our students and help them acquire those skills before graduation. That's a key part of what we do.
Can you maybe speak on the DVLC and how that is really great experience as well?
So the Distributed Veterinary Learning Community, DVLC, these are in most cases private practices that cooperate with us. We obviously have a relationship. We have a process where we onboard those practices, and the clinicians that are there become our instructors, and they take students in our fourth year program into those environments. So that allows our students to experience a wide variety of practice styles and locations. They can end up in, and they will, every student will spend time in rural Alberta, at least 6 weeks in a rural practice, most often more. And those practices can be general mixed animal practice, where you see whatever comes through the door or whatever's on the other end of the telephone, or they can be very focused kind of practices where they look just at dairy cattle, or work just with horses, or work just with companion animals or cats or exotics. So those options exist. We even have Dr. Doug Whiteside is on our faculty. He's also the head veterinarian at the zoo in Calgary. So students get an opportunity to spend time working with veterinarians in a zoo setting. There are lots of different settings. And so this allows students to experience the different environments, the different demands of different styles of practices and locations, to help them also build those skill sets, come up with their comfort zones as to what it is they think they would like to do with their career. And that's a really big asset in our program. And we're the only program in Canada that has that distributed model. There are only 5 veterinary schools in Canada. There's Alberta, there's the Western College in Saskatoon, there's the Ontario Veterinary College in Guelph, College in St. Hyacinthe in Quebec, and the AVC, the Atlantic Veterinary College in Prince Edward Island. That's it. And most of those all of those other schools run large veterinary teaching hospitals. So all of the clinical year is done at the same institution in a hospital setting. That's very unusual to what you're going to experience after graduation. Our students get to go out into real practices. They see a lot of primary care cases. That means the first presentation, that animal has been presented for the first time to a veterinarian, and you're there. That's typical of what you see after you graduate. In a veterinary teaching hospital, that's generally a referral environment. Those animals have been seen by a veterinarian. There's some other complicated problem, and they forward them on to those teaching hospitals, and that's where those other students get their experience. So we think it's a big asset, and a real opportunity and a real privilege for our students to be able to experience the environments that are very, very close to what life will be like when they graduate.
How many partner clinics do we have? We have about 60 plus right now, but with the expansion, we'll be looking at getting a little bit more. And then is it very often a student can get in after 2 years of undergrad if they have the prereqs?
Yep. It's usually something less than half of the class gets in after their first application. And a smaller subset of that would be those that are applying after just 2 years, because some folks apply don't apply for the first time till they've completed their degree or their 3rd year of their program. There are various reasons for that. But for sure, every year we have students who successfully enter the program after completing just 2 years of university. All right. I will exit stage left.
Thank you for joining, everyone.
Thank you. Good night.